this afternoon's webinar. I'll just walk us through, first of all, what we're going to do today. I'm going to take the first part of presenting, and then Glenn will sort of step in and do the second part. And we're going to try to leave lots of time for questions and discussion at the end. So thank you everybody for taking time on your busy day to spend some time with us. It's quite timely as the Kinesiology Coalition of Manitoba. One of our objectives right now is to spend a bit of time reaching out and sort of telling various people in different sectors and organizations a little bit more about ourselves and what we're doing. So this works quite well for us. So today's talk, first of all, we're going to talk a little bit about who we are, a little bit about the Kinesiology Coalition of Manitoba, and then we'll go directly into a little bit about what we do, a little bit of background about kinesiology, perhaps some of the value of additional certifications, and then I'll turn it over to Glenn, and Glenn will talk about where we're going now, looking at what's happening, as people are probably aware of, with the College of Kinesiologists of Ontario, and then what we're looking at in Manitoba. We have a bit of a varied audience here today, so I think people have some different level of background, so we won't spend a lot of time on some of the background information, but some people have more background than others. So first of all, the Kinesiology Coalition of Manitoba, our purpose is to provide clear, consistent, and visionary leadership for kinesiology in Manitoba, leading to legislation under the Regulated Health Professions Act, which came into being in 2009. We've been around for about 5 years. We actually were begun by a meeting of the Faculty of Kinesiology and Recreation Management at U of M and the Faculty of Kinesiology at the University of Winnipeg. We got together back in 2008 and agreed on the need to develop a scope of practice, competencies, and academic requirements for kinesiology in Manitoba. After the universities met, we invited others to the table, including the Manitoba Kinesiologist Association, Athletic Therapist Association, the MFC, the Winnipeg Regional Health Authority, the CSEP Health and Fitness Program, and the private sector. And we meet regularly to discuss issues like the scope of practice, legislation, and other items such as standards, curriculum in universities, liability, and advocacy. We've also been consulting regularly with the Canadian Kinesiologist Association and with the Ontario Kinesiologist Association regarding the national scene, what's been happening in Ontario, and getting some ideas and some supports for them in what we're doing here in Manitoba. We have quite a large membership. You can see those are the current members right now. Obviously, the people change sometimes, but the organizations do stay the same. And we have also room for up to 8 members at large who also come from a variety of private sector universities, WRHA, sport associations, etc. Okay, many of you out there probably are aware of the importance of forming an organization like the Kinesiology Coalition of Manitoba. First of all, as no surprise to any of you, I'm sure the benefits of physical activity have been increasingly recognized in many, many realms, whether it's physical health, whether it's mental health, whether it's social well-being, quality of life. More and more, we're getting interest from the medical community around physical activity in both chronic disease prevention and management. We also know that healthcare providers currently are not trained to promote and prescribe physical activity. However, if we want to sit at the table with the healthcare providers in terms of providing physical activity and exercise guidance, prescription, assessment, etc., we need to have a defined scope of practice. We need professional regulations and a code of conduct in order to be able to sit at the same table and be accepted as members of the healthcare team, and also for our members and for kinesiologists to be eligible for healthcare coverage for their services. Finally, we also realize that the public and even other health professionals are not aware always of what we do as kinesiologists, or they're a little bit confused about who we are and what our role is. And we should mention at this time, and Glenn might speak to this a little bit more later, that athletic therapists are also seeking legislation. They have kinesiology degrees. So graduates from kinesiology at U of M and U of W with athletic therapy are also part of our sort of the group that we're working with in this initiative. Okay, just a little bit of background, again, not news to most of you, I don't think, but the evidence that the importance of physical activity is that, as we know, the Canadian economy is spending billions of dollars every year on loss of productivity, both personal and financial, due to poor health of workers. We know every year we hear about more and more chronic health conditions for which physical activity is a modifiable risk factor. Physical activity, we now know, can aid in decreasing risk and helping to prevent at least 25 chronic health conditions. Some of the most common ones we hear about, of course, type 2 diabetes, cardiovascular disease, stroke, etc., and some cancers, more and more cancers coming also into the picture. The World Health Organization in 2009 recognized physical inactivity as now the 4th leading independent risk factor for death caused by non-communicable diseases, up there with blood pressure, tobacco use, and elevated blood glucose. So again, we're very, very important and on the radar of the healthcare professionals. Some of you may have seen the economic analysis of risk factors in Manitoba that came out in 2010, a joint project of Heart and Stroke Foundation, Cancer Care, Health in Common, and the Alliance for the Prevention of Chronic Disease. And we know for Manitoba specifically that about 10% of the annual healthcare funding is actually going for direct costs of illness costs related to smoking, physical inactivity, and people being overweight and obese, and that's $492 million annually in Manitoba. When you factor in indirect costs like loss of productivity, disability insurance, etc., it comes out to over $1.6 billion annually. So the purpose of all those past points I've just made is, taken together, you can see that kinesiologists have a key role to play in helping to reduce these risk factors that are so critical to the prevention of many chronic diseases. Now, the Kinesiology Coalition of Manitoba has our definition of kinesiology, which is very similar to other definitions, but again, definitions vary a little bit by location. We consider kinesiology to be the science of human movement, encompassing both its physical and psychosocial aspects. And the psychosocial aspects are more prominently acknowledged in our definition. They're certainly part of any definition. The behavioral part of physical activity is important, but we feel it's important to actually highlight the fact that the behavioral part is important to having the physical accompanying human movement. In terms of our scope of practice, kinesiologists promote and provide best practices in prevention, assessment, and intervention to enhance and maintain fitness, health, and wellness, performance and function in the areas of sport, recreation, work, exercise, and in activities of daily living. Now, to be deemed to be a kinesiologist, basically you have to have a 4-year university degree in kinesiology or a related area, and things like liability insurance, etc., are certainly also recommended when you're practicing as a kinesiologist. The next thing I'd like to just talk about briefly is whether or not additional certifications are recommended or necessary when one wants to practice as a kinesiologist. CSEP, or the Canadian Society for Exercise Physiology, which is the main provider of certifications in Canada, has a position statement on fitness certifications. And they say whether it's concurrent with your getting your degree or following the completion of your post-secondary accredited academic requirements in the area of physical activity and exercise sciences, it's recommended that students seek out Canadian or internationally recognized certifications, which basically allows you to get a more standardized understanding of what competencies and what knowledge and skills people have, as the kinesiology degree requirements may differ slightly or even considerably in different universities. However, the qualifications you need to do the work of physical activity and exercise, prescription, promotion, etc., are going to depend on the risk level of your client and also somewhat on the type of intervention that you are providing. And so we consider the American College of Sports Medicine Exercise Assessment and Testing Guidelines, the 9th edition, which actually just came out, actually the date's 2014, but it's their new guidelines, and considering risk as low risk, moderate risk, and high risk. And these are based on whether or not somebody has known disease, signs and symptoms of disease, or actual just risk factors of disease. So if you have less than 2 risk factors for cardiovascular disease, you're deemed low risk. If you have greater than or equal to 2 risk factors, you're moderate risk. And if you have, and both of those, you're asymptomatic. High risk, you would either be symptomatic or have known disease. And so again, the qualifications required to work with these groups does vary a little bit. We always talked about people being healthy or apparently healthy in the past, and now we're just sort of framing it more within the actual risk category. So for your low risk individuals, there's also a role for non-degreed professionals, and this is something with the Kinesiology Coalition of Manitoba. We have been partnering and working with Manitoba Fitness Council. We believe as a group that we all have a role to play, that we, again, looking at the different risk levels and the different types of services we provide. So in areas of things like instructing group exercise classes, fitness leaders, even working as peer leaders and training peer leaders, perhaps in providing more of the motivational and behavioral supports, not necessarily the individual exercise prescription. There is a role for people who have other certifications but are not yet necessarily degreed. And these individuals will often be supervised by or work with kinesiologists. So for example, as I mentioned, the Manitoba Fitness Council, that most of us are familiar with, have different programs for, like the Active Living Facilitator, which is more of a motivational behavioral support program. There's several specialty modules that you can train for as a fitness leader. The fitness theory is required first in some core areas of fitness, and then there's a 24-hour modules in different areas like group fitness, active older adult, yoga fitness, etc., resistance training, and aquatic fitness. Now, when you move to certifications, so working again with the low risk or healthy population, the main certification in Canada that's recognized is the Canadian Society for Exercise Physiology Certified Personal Trainer, or CSEP-CPT. This is still an entry-level certification. You're required to have 2 years of college or be within have your 2 years of university. There's basically 6 core course areas that you're required to have. The CSEP website has all the requirements. If you want more information, it's quite well spelled out there. And these CSEP-CPTs, quite specifically, are sanctioned within a relatively sort of a narrow scope of practice in some ways. It's to administer the CPAFLA, or the Canadian Physical Activity Fitness and Lifestyle Appraisal, but they also have a role in kind of more healthy lifestyle guidance and prescription and promotion as well. Crossing the border into the U.S., the American College of Sports Medicine, which most of us are familiar with, has their health and fitness specialist, requires a university degree, and they also have ACSM personal trainer. And many people in Manitoba also have the National Strength and Conditioning Association certification, the Certified Strength and Conditioning Specialist, much more sort of tailored to strength and conditioning services. And again, it requires a university degree for that certification. Now, if we move to the more higher risk, so either moderate or high risk, so people that either have significant numbers of risk factors or who actually have symptoms or known disease, which includes clinical populations. In Canada, the certification sort of recommended is the CSEP Certified Exercise Physiologist, or the CEP. Again, it's the highest Canadian certification. It requires a university degree, 4 years in exercise science, kinesiology, or equivalent. There's 200 hours of clinical exercise experience recommended, again, in things like musculoskeletal, metabolic, cardiovascular, aging areas, sort of 50 to 25 hours in each of those, as well as 100 hours hands-on performance and health-related fitness experience. There's also different ways of getting into the certification, so categories A and B just relate to the fact if you have your kinesiology or your exercise science degree, you have greater clinical requirements to demonstrate, which is category A. Category B are people who have a kin or a kinesiology degree or equivalent, but they've also got a medical designation, so they might have a physical therapist, OT, nursing, or physician. They have are assumed to have the more of the clinical experience, but then they're required to still recommended to have the health and performance-related fitness experience that they may not have. And then going to the US, the ACSM also has their certified exercise specialist. There's a few people with that in Manitoba. Again, university degree required and 400 plus hours of experience is actually required. Now, the last point I want to make before I hand over to Glenn is some of the difficulties with the huge proliferation of the non-degree certifications and training programs. Some of them might be quite valid and good. As I mentioned, the Manitoba Fitness Council, we know what they are, we know how the assessment's done, so we recognize the important role that graduates of those might have. The issue being there's hundreds of non-degree sort of certifications available out there. CanFit Pro Personal Training Specialist, very common in Canada. We know it could be completed in maybe 16 hours. They're directing, which is a good thing, at healthy people, group fitness resistance training, so the focus is on healthy populations. If you look at another common one in Canada, the Good Life fitness centers have their own Good Life Personal Training Institute, which I just looked at more online today. People there actually get the CanFit Pro membership when they train. However, to train as a Good Life personal trainer, there's no degree required, and it's basically 27 hours of training. So again, I'm not quite sure how they're assessed, but there's, again, many, many more of them. The one in the US I wanted to finish off briefly is the American Council on Exercise, or ACE, which is kind of a web-based program. There's no skill-based test, and they sell basically a variety of products, which are basically manuals for studying for doing your online test eventually. Some of the products they sell is you can actually train as an orthopedic exercise specialist, a therapeutic exercise specialist, functional exercise specialist, or in the area of weight loss management, for example. Their website's kind of interesting. They actually have a table where you can actually go down and compare hundreds of different certifications, with obviously the intent being to show that theirs is actually the best one. One thing I did notice about theirs today is that you don't even have to have a high school diploma to train as an ACE exercise specialist in any of those areas. So the thing that caught my attention especially was basically they're obviously catering to people that want to train to be personal trainers and have these specialist backgrounds. They pitch it to people with health designations. They're saying that's who they want, but again, there's no guarantee that that's who they're getting. And so it's very much around the costing, the online testing, and you can see that 87% people pass on their first attempt, which is kind of one of their advertising points. They're basically really trying to attract you in, and they want you to spend your money there and get your training with them. So again, the concern with all of these certifications is the fact that we have no quality control over them, and we don't really know what the content is, and even worse than that, we don't usually know how people are assessed and examined, and there may be no follow-up requirement to keep your level current as well. So I'm going to leave it there, and thanks everybody for your attention. I'm going to turn it over to Glenn, and he's going to take us a little bit more looking forward on where we're planning to go now in Manitoba.
Well, thank you very much, Liz. I want to thank you very much for doing a great job, I thought, of giving us the lay of the land, both from where the Kinesiology Association has come from and also where the whole area of certification for kinesiology is at the moment in Canada, and particularly in Manitoba. I guess what we want to do now is to give you a little bit more of information about where are we going from this point on, and give you a little bit of an idea of the objectives that we have as the Kinesiology Coalition of Manitoba. And as Liz has said from the outset, the purpose of the Kinesiology Coalition of Manitoba is really one to move towards legislation, and so the universities that we indicated got together and felt that we needed to be facilitators of the professional organizations in Manitoba that had anything to do with kinesiology and the practice of kinesiology here in Manitoba. So, but from the get-go and all throughout the whole process, it's always been our end point was to seek legislation, at which point in time the Kinesiology Coalition's purpose would have been complete, and the mandate would either cease to exist or it would have to change somehow or other. So, as I said, we're looking to moving towards legislation as our prime goal, but it's really important for people to really understand what that really means. From a standpoint of legislation, what is it that allows a profession to come forward and really meet the criteria or be eligible to seek legislation? Well, the first thing is that there needs to be a demonstrated need to the public to protect the public. So we need to be able to say that that the things that we do, the actions that we do, the interventions we provide have a potential risk to the public. And if it's not done properly, then the public needs to be well informed as to the standard of care that they're being provided, so that we can ensure that whatever intervention is being provided to them is reasonably safe. The other is that there needs to be a critical mass of practitioners that are willing to pursue legislation. So we need enough people who are actually practicing kinesiology, who do want to be able to protect that name, who want to have their profession recognized, and are willing to support the whole initiative. And as I will talk in a few minutes, it'll be not just in terms of protecting you, but it's really creating a system where the public is being protected, and we will take responsibility to make sure that that happens. The profession that would come forward to government seeking legislation must have a defined scope of practice and must have clearly outlined competencies of the things that they do. So when we talk about trying to identify exactly what a kinesiologist does, and more importantly, what the kinesiologist does not do, we will then put that into legislation, and that will become defined and will be regulated that way. We will also want to, in terms of legislation, have to define the minimum academic requirements that are required of people who are going to put themselves out into the public as being a kinesiologist. And so it's ensuring that to the public, again, that the people who come out and use that term and present themselves in that and provide the services within the scope of practice have met the academic requirements to ensure that they can do that in a safe and effective manner. The colleges would also have to ensure that we would, in addition to your university degree, we would have to ensure that, in fact, those competencies and the person has the competencies from an applied and knowledge base. So there would have to be some type of a recognized and approved certification process. And in other professions, there are national-based exams. Some have provincially-based exams, but there would be an exam, a competency exam that would be in addition to your degree. Once you finish your degree, you would then have to demonstrate that you have competencies in these areas. And it may be a knowledge-based exam, it may be an applied-based exam, or it may be a combination of both. The other issue is that we want to ensure, again, that the members who are calling themselves kinesiologists will have a liability insurance for two reasons. One, to protect themselves, so that they're properly protected in terms of any liability questions that may arise, but also to protect the public, so that if the public felt that there was recourse required from any member, that there would be financial means by which that recourse would be accessible to the public. So that would be a requirement that anybody would have to have this liability insurance. The other is that we have to have well-articulated and clearly defined code of ethics, and this goes back to the whole notion of saying, are you working within your scope of practice, and clearly identifying what you can do, what you cannot do, and also within that explaining the ethical behavior that would be expected of a professional providing those types of services. And those ethical policies and procedures would really outline the scope by which the college would have to take action should you contravene any of those things. So it really defines the parameters within which you are going to be able to work. The other, the last one in terms of the requirement is we also need to have the support of other allied health professions. And as Liz has indicated, one of the primary reasons why we want to see the legislation go forward is to be able to be included into the whole health care team. And obviously, if that's our primary mandate, then we would also have to have and want to have the support of other allied professionals and including us into the healthcare team. So when you go forward with legislation, the government will ask, do you have that type of support? So that would be the physicians, the physiotherapists, occupational therapists, and any number of other allied health professionals who would have any kind of related comment or relationship with us in terms of providing care. So it all goes back now to looking at developing a college. I've mentioned that word a number of times, and this would be a college that would be specific to the province of Manitoba. It would be licensed within the province of Manitoba, and the rules and regulations would be limited and enforced only in Manitoba. But they would apply to anybody practicing in Manitoba, and anybody coming from outside of Manitoba into our province would have to follow these similar guidelines. So just to note again that the college is a regulating body. It is not a body that promotes the profession. It's not a body that promotes individual educational opportunities, etc. It will regulate the practice of kinesiology. Its primary function is to protect the public. So it's distinct from your degree. If you become a member of the college, and we'll use for the working term the College of Kinesiology, then you then are provided the distinction of right to title. And only until you do that can you use that title. So it may be that you would come out and graduate from a degree in kinesiology, but in fact you could not use the term kinesiologist. If that's in fact a regulated term that we do come up with, you would not be able to use that term. You could say that you have a degree in kinesiology, but you're not a kinesiologist until you've met the requirements of the college and passed all those exams and met all the criteria that we mentioned earlier. These are similar to other colleges. So similarly, if you were a member of the Manitoba Medical Association, then you are a member of a group of an association of like-minded people who support each other in continuing education and perhaps professional support in other areas. But that is, the Manitoba Medical Association is very different from the College of Physicians and Surgeons of Manitoba. And as I said, the College then of Physicians and Surgeons of Manitoba, their prime requirement and mandate is to protect the public and to regulate the profession to ensure that whatever is being done, any service provided by the professional themselves is safe and effective, and if it's not, it's their responsibility then to take action and to impose disciplinary action to whatever degree is required. Just to give you an example, we're not reinventing the wheel here. As many of you may know already, that the College of Kinesiology of Ontario is now enacted and in place as of April 1 of this year. They have been diligently working on this for 2 or 3 years, and it's now been proclaimed and in fact in force as of the 1st of April. They will be having their certification exams. They've announced that. There will be a set of certification exams on the 25th of May and another one on October 19th. So they are well entrenched now and they're moving forward. So we can take a lot of information from them and take a lead in terms of the things that they want. And the other thing that's really important, I think, to think about is that we would like, because there's a momentum that's moving across the country, that provincial governments and federal governments would like to see portability of certifications. So it'd be preferable from a federal point of view and individual provinces to be able to say that people who are certified in Ontario would meet the same requirements that we may set in Manitoba, and vice versa. If a person from Manitoba went to Ontario, that they would have similar requirements, so that there would be a seamless transition in terms of moving your practice from one province to the other. But to give you an idea of what's happening in Ontario, and this is a long slide, but it really just talks to you about what in fact their responsibilities are. So they establish entry to practice processes as well as standards of practice for kinesiologists. So they now have identified the curriculum requirements that you have, and also the standards of what the scope of practice of kinesiology, what the standards are, what the ethics are, and they now define the profession of kinesiology. They review the practice of members. So if there is a complaint from the public that, on the practice of a particular member, then they would be the people who would review that practice and make it and determine whether or not there was grounds for complaints or not. They require members to participate in ongoing professional development. So in much of the way many of our professions, as our associations have asked us to do this, this will now be a requirement of the college. So the college will want to ensure that from year to year that you are keeping abreast with the new changes and advances in the profession, and again, just making sure that you continually become effective in your practice, but also safe. They will hold the members accountable for professional misconduct. So they will be the disciplinary body that will conduct the investigation, adjudicate, and provide the disciplinary procedures and enforce those disciplinary procedures that may be required. They restrict the acts and procedures of practitioners to be performed. So as I said, it's not only what you can do, but it's also what you can't do. They will identify that. And it's also, I've mentioned this and alluded to this many times, that they will grant you the right to use the term. And in their case right now, it's kinesiologist, and they'll also allow you to, if you've certified, use the letters behind your name of R-Kin. So implying it's a registered kinesiologist. They design the process for investigating and addressing public complaints, so they will be the ones who would do that. They administer the disciplinary procedure measures where necessary, and their overall, the whole overall is to protect the integrity of the profession as well as protect the public. So these are the ones that come right from the College of Kinesiologists of Ontario in terms of their mandate. So if we look at that and say, okay, well, what are the good things and what are the bad things about legislation? Because we do have to have buy-in from all of our members. But the pros of the legislation are going to be, as I've mentioned here already, right to title. So that is the largest portion of the benefit to legislation for you individually, is that you have the right to title of the term kinesiologist. If that's where we're going, that has not been determined in terms of what the actual name will be. But in Ontario, it is registered kinesiologist, so it may be that we move in that way. And in the case of athletic therapists, the term athletic therapist would be the protected terminology. The professions are empowered to protect the public from unqualified practitioners, and we've gone through that a little bit in terms of what Ontario has done. They're empowered to expect minimum professional standards, so this is the academic preparation entry level coming in, as well as your continuing education. And the profession gains legitimacy in the eyes of the allied professions. And I think Liz has alluded to this as one of the requirements or the objectives that we want to do, and the reasons why we're moving this way is to really gain legitimacy in the overall health scheme of things with all the other health professionals, insurance agencies, and government agencies. So these are all good things that I think come from the legislation. The other side of the coin of things that you need to be aware of, and we all need to be willing to live with, is individuals may lose privilege of practicing kinesiology if they do not meet the standards. So once those standards are set, if there are people in our profession who do not meet that standard, they may not be able to use the terminology. They may exclude it from that unless they go forward and meet that. Now I can tell you that in Ontario they do have a grandfathering clause, and so that's sort of a standard that we would look at and say, well, how do we bring people in who have been practicing before the legislation, and what criteria would we have to meet to ensure that we have safety of the public in that area. So there would be a grandfathering clause, I would assume, that would come out of our legislation as well. The scope of practice may be limited and impede on past practice, and then once you define the scope of practice, it says what you can and what you can't do, and there may possibly be things that you normally do that you will not be able to do now because it might be deemed to be outside of our scope of practice. That has not been determined in any way. That comes with a lot of negotiation. It comes partly with discussions with other health professionals. But it's one of those risks that we take when you go to legislation that they may say, well, yeah, you can do these things, but you will not be able to do these things because it may be beyond your scope. But we would always want to argue the fact that our academic preparation allows us to do these things. And as long as you can always argue and go back to the academic preparation of the professional and give them the confidence to do that, then we would want to make those kinds of arguments. And obviously, if there are some things that people are doing in terms of practice strategies and practices that we don't have academic preparation for, then rightly so that we should be saying that maybe you should be doing that because it may be putting the public at risk. The greater level of accountability, because now there will be a college that you will have to answer to, and you will have to be accountable to them in terms of credentials. There will be an annual maintenance fee. There will be another body that we will have to be accountable to, and this one will have teeth in it, and that it will have the capacity to either rescind or suspend or revoke your right to title and your right to practice. Financially, there will be some cost to it because we will have to have this college will have to support a paid staff. We will have to pay for administration, so there will be a membership fee to the college. When you are entered into college, there would be a fee to support these services. There will be an obligation to police the membership on contravention. So if we have to go to legal, if we have to take someone and legal disciplinary procedures, there may be costs, legal fees that may be incurred, and that would also have to come out of the funds that would be generated out of the college. And those funds come from our members. The actual numbers of cost of to belong to the college in Manitoba have not been determined at this point in time, but it was something we have to look at. What we're suggesting here, and just there's discussions that have come out of the coalition, we see ourselves going to the province of Manitoba and asking for an act, the Kinesiology Act of Manitoba. This essentially would be an omnibus bill, an act. In other words, it would be an umbrella act of which a number of different substreams could fit. And when we do that, when we bring a number of groups together under one act, then we do provide ourselves with the numbers that are required for legislation. And basically that's saying, do you have the number of people who are going to be able to support financially the college and be able to support any legal actions that may be taken against people? So remember also that the college is there to regulate, and it's the profession, and it's also to protect the public. And I can't reinforce that more than it really is a big issue. We could reckon that the Act would recognize basic core competencies. It could include subspecialties, as I've mentioned here, and we're looking at this point right now. We've mentioned athletic therapy and kinesiology, but it could actually have more other groups who may feel that they fit into this category if they can come in with the right arguments and the right core competencies, and then we could fit them into this omnibus umbrella bill. So at the current time, we're really only talking with kinesiology and athletic therapy as two groups that have organizations that seem to fit the criteria at this point in time. So we're looking at the Kinesiology Act, this umbrella bill, under which would be the athletic therapists and the kinesiologists. And I've subtitled kinesiology here in terms of other groups, and Liz has made mention to this in terms of the different types of clientele that we may be working with, in high risk, medium, and low risk. And so it may be, and this is a schematic. This is not ground in stone in any way, shape, or form, but that it would be that we would have a separate category for CEPs with criteria, and a separate category for CPTs, and a separate category for a group such as the Manitoba Fitness Council, and that type of group that would fit into. And we'd have to develop criteria for inclusion in all three of those areas. Under the athletic therapy at the moment, it would be just that one standalone, and they already have their scope of practice well defined. In terms of the next steps, as a coalition, I think we've done a fair amount in terms of define the scope of practice. What we need to do is define the professionals. Who are they? Trying to get a handle on the number of people who would be included in the Act. And so whether we go CEPs, CPTs, and MFC, we then would have to determine who those people are, how many of them are willing to come into the college, and what kind of critical mass of people we have. establishes the scope of practice and the legal documents of each one of the professions, and the Manitoba Kinesiology Association and the Manitoba Athletic Therapy Association are well on their way to provide most of those documents, and they're in the works in terms of putting it together in terms of an application. Then we would want to solicit support from other health professionals. So once we determine that in fact our professionals want us to go forward, and I think we have that to some degree, then we got to clearly identify who we are, take this to their health professionals, and get the support for it. Subsequently, then we meet with the government, and once we do that and submit our application, then we also have to garner the support of the public in terms of moving us forward. And I think you've probably seen in the last little while, there's the Paramedic Association of Manitoba and the Massage Therapy Association of Manitoba are currently in the works of doing this. And so you've probably seen some ads, particularly from the Massage Therapy Association, saying that they want to be number 24, which would be the 24th profession. And they've just been doing a lot of promotional campaigns to get the public on side, so that if government went to ask the public whether or not they felt the massage therapist should be regulated, that they would get that support. We would be doing a similar kind of thing in our process. So we have done a professional survey, and I think we need to maybe expand that again and do it again, so try and capture as many people as we can. We will advocate for the Manitoba Kinesiology Association, and they have their association now well entrenched. And then we want to meet with the ministers and see what is the best way for us to go forward with this. And I know that the government has said that they want to get through these first two and learn, because it's the first two that they've done, and to learn from those, and then we'll see what transpires in terms of processes. And we're happy to learn from their experience as well. And also getting interest from the media will be another way of getting to the public in terms of where we go. So we're at the stage now where we're putting together the applications. We are waiting for the massage therapy and paramedics to go through their process and then go forward with the ministers with our formal application. After which time it will be a question of really promoting with other health professionals and with the public through the media. I think that's about as much. I hope I've been clear on there. If we can ask any more questions.
I think we actually have to ask you folks a question to submit to Stephanie, I think, for your credits, and then we also have to figure out how to get questions going here. So first of all, thank you, Glenn, and Stephanie has asked us to ask you to send back some thoughts to her directly, I think, and the question that we thought we'd be interested in, because we could use your to help us as well, if you could send your thoughts on regulating kinesiology in Manitoba, like what you think of this, and Glenn's gone over pros and cons, so just from where you're sitting, it would be useful to us, and if you could send to Stephanie your thoughts on regulating kinesiology in Manitoba, and then send it by email, Stephanie?
Yes, that would be fantastic. You can send it to sjeffrey@manitobafitnesscouncil.ca. So we're just opening up the lines for questions. So if you have a question, we have unmuted, I think, everybody. So if you have a question, you can feel free to ask, or if you prefer to type it in the chat box at the bottom, that would also be fantastic.
That are slightly off topic, I think. Sure, why not? You may not be able to answer them, but you can try.
I'm still trying to unmute people, so we're working on it. Okay, I think I've got everybody.
Okay, so Dean's writing a question in. How do we see the question? Okay. Oh, there's a number. Oh, we have lots of questions. Okay. Oh, okay. So those are just all okay. And this is the first one here. So the first question, I think, is from Candy that we're seeing. No, it's, if it's privately, do we answer it? It's okay. Okay. So if MFC is part of legislation, how would this impact the members of MFC? Which is an excellent question, and again, as Glenn mentioned, we haven't really sort of figured out how MFC would actually figure into this yet, or whether it would actually be officially part of any regulation going forward, or whether it would be a partnership, but necessarily not part of the regulation. And again, that would be, I think, something that MFC members would we would go to the MFC. We've already gone to the MFC once to kind of look at what we're doing, but I think that would be something we definitely MFC members would have to decide how they best see themselves sitting in.
The MFC has been at the table actively for the last number of years, so we're making sure that we are part of the process. And Liz is right that we're not sure exactly how we fit in, but we're just making sure that we're not being forgotten and that we're part of the equation.
So the next question is, does the College of Kinesiology of Ontario have the CSEP certification under its umbrella? To the best of my knowledge, they don't, and that they have their own certification requirements. So CSEP has an examination requirement, but that the college has its own certification.
And then the next question has to do with career opportunities. When pursuing a career in kinesiology, how do you best research these options? What are the job opportunities, earning potential, et cetera, which again is an excellent question, because as a relatively sort of new and changing profession, we don't necessarily, it isn't really printed, you don't see lots of jobs that sort of say kinesiologist necessarily in Manitoba. You do see more and more, obviously, in Ontario. So with the legislation coming in, it's sort of driving, it's kind of helping grow the field. I think the thing is with career options, and Glenn will probably want to jump in too, but from my perspective, having worked in this field for a long time, is that being aware of the breadth of things and the skills and knowledge base that we have in kinesiology. It's just that people out there don't necessarily always call it kinesiology. So when people are looking, whether it's in public health or in prevention, health promotion, even in the private sector, in community, promote physical activity, lifestyle sectors. There's more and more things in the regional health authorities, for example, in the municipal governments, private sector. There are positions out there, and we're seeing more of our graduates getting those positions, but they aren't necessarily called kinesiology positions, and they aren't even necessarily directed at kinesiologists all the time. But if you kind of read between the lines, you see that a lot of the skills and knowledges that they request, actually we do have. So I think until we actually have a firmer designation of who we are and what we do in Manitoba, we won't be seeing tons of kinesiologists necessarily advertised for with that name. But I think we are, if you watch Ontario, I think and even I think Alberta too, if you watch them over the last several years, we have seen more and more. So it's still a little bit vague, but I think it's just looking broader than, because people out there don't know who we are. Glenn wants to add to that.
And I totally agree, and I think it really comes down to, it's a process where we need to do some branding, and the branding of the term kinesiology, it needs to mean something for employers and the public. And so getting the Kinesiology Act and being able to get right to title will be a big step in terms of the branding of the profession. But also, just as an example, I know with the diabetes educator program, where we clearly identified physical activity as a major contributor to the treatment of diabetes and prevention of diabetes. But kinesiologists are not eligible to be a diabetes educator because we don't have legislation. And similarly, insurance companies will, I know, for example, in Australia, that the insurance companies are now paying for kinesiologists to provide preventative care. That will not happen in Canada until we have a clearly recognized profession with a well-defined scope of practice and good regulating body of which people can have some confidence in. So all of this is really pointing in that direction.
I see another question here that says, is it possible to get a copy of this presentation? And absolutely, after the session is over, this has been recorded and everyone will receive the link by email. Feel free to share it with colleagues, fitness leaders, anyone in the industry that might be interested in the information, because really it's about education, and we can't educate people if they don't have the opportunity to know exactly what we're trying to work towards.
And so the next question is, can you discuss an example of how grandfathering would work with a person who might have a degree in kin and C-STEP MSc certified as a CPT or CEP? I can give you what's happening in Ontario. They are grandfathering people in. The criteria is that the member must demonstrate a knowledge base in terms of their academic preparation. And it may not be a 4-year degree because it might not have been a 4-year degree prior to the proclamation. But they also have to show that they've done a minimum of 2,000 hours over the course of 3 years prior, and 1,500 of those hours have to be within the 3 years prior to proclamation of this bill, so as of April 1. So 3 years retrospectively, they have to demonstrate 1,500 hours of working in the profession. And they would then be exempt from writing the exam. So they would not have to write the exam, and they would be awarded the right to use the title. So I can only say that, you know, that's what's happened there. This would be something that I think we would not be adverse to having in some shape or form here in Manitoba. But it would be open to further negotiation.
Okay, we have another question around time frame. If we have any estimated guess or in terms of how long it might take for legislative approval. I know in Ontario it took several years. We had a guest come last year from Ontario, and I know it was many years. As Glenn mentioned, this is the first two massage therapists and paramedics are in the first two in the queue right now. They're going through, so we're watching pretty closely to see how that's received and, you know, how long that takes. They've just submitted them earlier this year, so I'm not sure how long the actual review process will take. Again, it's the first time they've gone through it. We've identified for the Kinesiology Coalition is that we need to do some significant promotion and work sort of on 3 fronts. We're starting with our own profession, so we need to actually gather and see in the tent who we all are, who are the groups that we want to go forward with. You know, the diagram that Glenn showed, are all of those groups on site, or there are other groups that might fit into the scope of practice. So we need to kind of gather ourselves first, promote, or this is what today's talk is partly a part of that. The general public is really, really key because legislation is not given to protect us as a profession. It's given to protect the public, and showing that we can reduce harm is going to be the key thing that we have to kind of demonstrate, is that by having regulation and legislation, it will significantly decrease harm to the public. So we need to, like as Massage has those bus ads going around now, we need to actually speak to the public as well and kind of get them asking for and recognizing the need to regulate. And then we also really have to talk to our colleagues in the allied health professions. We have to kind of make sure people understand that we are not trying to compete with any of them. We're proposing that we have a significant role to play as part of the team. I think there has been some recent research out of Ontario. There was a study that I just saw actually last week that actually shows that in Ontario, the allied health providers, according to the study, are not feeling that as a challenge or a threat. They're actually seeing the potential benefit. We have that sense here. There's some, you know, things going on, some you know, about the Encourage research project going on in Manitoba, for example, with the kinesiologists placed into access health clinics, is that the healthcare providers really want us there. They recognize that what we do, they can't do, whether it's due to lack of training or lack of time, or we have a role to play. So I think given the need for us to sort of promote to those 3 groups, including ourselves, and then to actually see the time frame to get our proposal. We're already working on it. We're actually working on the submissions now as a coalition. I think it's going to be a couple of years. Would you say, Glenn?
Yeah, I think so.
Yeah, a couple of years. It's not months. It's going to be a couple of years anyway.
I would just add to the fact that what Liz is saying about trying to get our house together and finding out the sort of the critical mass. On your website right now, on the screen, you see the Facebook designation for kinesiology in Manitoba. We highly encourage you to go to that site and join the site so that we know the number of people, and it also gives us a method of communicating with people in a very efficient way, or for you to communicate back to us. That would be a very important thing for that to happen. The other thing is, in terms of the establishment that there could be potential harm to the public. We're fortunate in that a lot of that legwork has been done in Ontario now, and so it looks like, you know, that we would be able to bring this thing forward because lots of precedent has been established, and you know, a lot of groundwork has been done. So we're looking even more positively about the whole thing. Okay, so the question here is, the question will be, what will this mean for outfits like CanFit Pro? Well, as I think we indicated that there is room for people to work in low-risk populations, but that has to be clearly identified, and whether or not it's the MFC designations and training that becomes the standard, or whether it's something that's within the CanFit Pro modality, that needs to be looked at. But certainly, the legislation would call for creating standards, and anybody who wants to be included in the legislation would have to meet that standard.
And I think the general public would have a lot of power there, because in a sense they would be more educated, and so if they would perhaps seek out somebody who had the credentials for what they needed, and so in a sense, and the CanFit Pros, I mean, it's a huge industry. I don't think it's going to, regulation won't probably wipe that industry off the face of the map, I'm sure, but they'll probably have to find different niches. And then again, we're more concerned in terms of making sure that the public knows who we are and what we do and where to find us. And hopefully those standards will sort of leak over into the more community fitness centers, et cetera, and that people will be asking for them. So if people are demanding that their personal trainers or their physical activity specialists have this requirement, maybe we'll be seeing the push eventually towards them having to hire people with better training and actually pay for them better. So that, again, not really predict, but that's the way we'd like to see it go.
I guess in the interest of time, because I think we're reaching the end of our time, unless there's another question that wants to come in right in a moment, I will direct you again to the screen. So that you have, I'm just reading a little message that might be coming in here, but we've got one question coming. Going forward, what should acting kin and CSEP CPT people be doing? Well, I guess first thing is make sure that you're registered with me, keep abreast as to what we're doing, and we welcome any input that people will have. If you're interested in getting information from us, let us know, and we can pass information. You can give us some of your input on it, so we'd be happy to do that.
And I'd also like to thank everybody for sort of tuning in this afternoon and sort of saying it is exciting, and in a sense it's about you people, in the sense we're trying to go forward and sort of get a sense of what people would like to have happen, and the benefits are going to be, I think, quite significant, but we have to there's a lot of work to be done, and I think we're going to have to get, the more people, as Glenn said, join up on Facebook and sort of play a part. There's a part for everybody to play in supporting this and helping move it forward, so we can't do it without the numbers, and so I think it's really important. So talk it up, join Facebook, and if you have other questions, whatever, email Glenn and my email addresses are there, so get in touch and we'll just keep pushing things forward.
Yeah, I'd also maybe say that you probably want to get in touch with the Manitoba Kinesiology Association as well, and CSEP, and make sure that you're registered with them and that you're part of that registered body.
I guess the last thing Stephanie's just reminding me, I think I did ask you to submit your thoughts to us. So basically the question we had was if you could send to Stephanie, just a reminder, your thoughts on regulating kinesiology in Manitoba now that you've actually been party of this discussion. You've seen some of the sort of challenges we have and some of the great opportunities. So if you could just send your thoughts, and again, that would help us as we go forward, because it helps us get a sense of how people are feeling out there as well. So thank you very much.
I'd just like to say thank you to Glenn and Liz for providing us with some expertise and some time today. And I know that it is something that they're very passionate about, and I think that came through in the presentation today. Thank you so much, and you'll be receiving the presentation shortly.
Something about battery operated